So we can deal with everybody from a family, in a family. So whether it is a newborn, a toddler. So firstly you have already panicked, then you have sought an appointment from a cardiologist who is going to see you, and in the bargain probably a genuine cardiac patient gets pushed in the queue.
Good afternoon, Dr. Jyotika. Thank you so much for joining us on our channel.
Thank you for having me here.
So, you're a family doctor.
Yeah,
You've done your DNB in family medicine.
that's right.
Okay. So, could you tell us what family medicine is?
Yes, so family medicine is another branch of post graduation wherein we study about how to deal with the entire family.
Okay.
So this is like MD, DNB, this is a 3-year post graduation.
Okay.
And we specialize in family medicine. So we are specialist family doctors.
Okay. So, you deal with the entire family. Is that what it is?
That's absolutely right.
Okay. So, what made you choose this field?
Oh, yes, that's such an interesting question. So, I wouldn't say I chose it actively.
Okay.
So, when I wrote my postgraduate exams and I got a certain rank, my criteria was that I have to choose something in Bangalore.
Okay.
And I needed something on the medicine related, not the surgical field. What I mean to say, it had to be something medical related. So either the general medicine, or then I was advised by a lot of seniors and a few other whatever family friends or somebody that why not choose family medicine.
Okay.
And then it made sense to me because I thought it will make me or help me practice in the same way that I have been wanting to. So I didn't want a surgical field, and I'll be able to deal with different types of patients.
Okay. Okay. So, before getting into what is your scope of service, I'd like to know how satisfying has your field been for you so far?
Yeah. Initially, when I took this postgraduate seat, and then while I was pursuing it, there were many questions. What will I do after I finish? Do I have to get a good job in a hospital? Or, am I really even going to be able to sustain myself? But yes, I think after 10 plus years of being here, I think it's the best decision I made in the best circumstances. And it has really been fulfilling. Every day is different, and every patient who walks into my clinic is different. So there is no monotony, and we learn a lot from our patients also.
Could you elaborate a little more on that? What is it that what do you mean when you say you learn from your patients?
So there have been instances wherein I have seen kids, parents, or grandparents coming. I have seen people coming with probably say emotional issues wherein they don't need a treatment from me. They want me to just listen to them. Then I have had patients. They've had some family feud, so that is stressing them out, and they just want to come and discuss with me. They don't need me to write a tablet, or they don't need me to give an injection. They just want somebody to listen to. Same way, somebody needs an advice about how do I start exercising, or I am not able to cope with my studies. So there is such a different variety of people who come that I learn every day.
Okay. Have you ever felt that these kind of patients that you encounter don't really look for medical advice from you? And have you felt that that's like it's not my time utilized properly?
So sometimes, yeah, they may not be looking at, probably I can say medical advice, yes, it is still some advice. And no, at the end of the day, I don't think that's a waste of time. I have helped them in some way. And that is the essence of your family doctor. You should be able to reach out to your family doctor for any ailment. That ailment cannot be described.
Okay.
You are not feeling well, you come. So the feeling well could be the mind, the body, anything. And that's how I think, the awareness is increasing that mental health
Right. Yeah.
is equally important, not just physical health. So I would rather be happy to have my patients or the people coming to me, if they feel they are not well, they can come to me. They don't have to measure their ailment or describe their ailment.
Okay. Since you mentioned about the various things that patients come to you with, could you explain about what is your elaborate scope of service that you do?
Okay, yes. So, as qualified family doctors, taking into consideration our curriculum also, so we can deal with everybody from a family, in a family.
Okay.
So, whether it is a newborn, a toddler, adolescent, adult, women in the reproductive age group, pregnant females, and then finally the elderly.
Okay.
So you see, the way I described, each of those age groups have different requirements.
Right. Yeah.
And by requirements, like I said, it could be even preventive. It could be vaccination related, advice on what to eat, what not to eat, what to exercise. So everything need not be just curative. So that is where our family doctor plays the most important role. I think we all, when we were growing up, or when our parents were growing up, there used to be one family doctor who knew everything about your family, and you could go to that person for every ailment. Somehow in the past 20 odd years, I think that got lost somewhere in modernization, corporatization. So that is something we are trying to bring back by bringing back the family doctor to the community.
Okay. What do you think is the reason for that fallback of the family medicine area? And then what do you also think is the reason that it's coming up again?
So reason why there was a fallback, I think, suddenly there was the internet boom and modernization, liberalization. There was a lot of intermingling of culture from the West, East, everything. So people started getting information which probably was not fully right. And they started accessing healthcare also in the same way. Maybe I would say 30 odd years back, there were no hospitals, there were no multi-speciality, nursing homes, hospitals. You have your family doctor in the community who lives very close to your house. You go to him or her for your problems, you get treated. In severe cases is when you go to a hospital for admission. Even that is based on the advice of your doctor.
Okay.
Somewhere in the past, when the hospital started booming, whether the establishments came from outside India or even within India, people had access. Okay, they could directly go and visit the specialist, the super specialist, as it is called in India. Actually, that term is only used in India, super specialist. Nowhere else. Everywhere it's same. Whether you are a cardiologist or a family medicine specialist or a gynecologist, it's the same band.
Okay.
So because people thought they could access the doctors easily, they started reaching out to those specialists even for minor complaints. And then the specialist has to evaluate them. Sometimes there could be a real problem, and sometimes they would say, okay, you don't have a major problem, go back to your doctor, go back to your family doctor. And then they would go back to their physician saying, okay doctor, I did these checkups and everything is fine, please tell me what is to be done. So if you notice, that is a reversal. Ideally you should go to your family doctor, sort out the small problems, go to a specialist or a surgical thing only if required, and then you come back to your doctor for your follow-up.
Okay.
So somewhere there was blurring of this whole process and method, and people started approaching the specialist directly without understanding their problem. And I think the Google internet has increased that confusion in the minds of people.
Okay. For people to understand this better, right, what do you think would be the problem people would encounter if they approached a specialist first before going to a family doctor?
So probably I'll take that question with an example.
Sure.
So example, you have a heartburn.
Okay.
And everybody does that. They will first check, okay, I'm having a heartburn, what could it be? So the internet is just a collection of information. So it will give you everything from an acidity to a heart attack and something major. So you will panic and you will immediately book an appointment for a cardiologist. And in India, we can get direct appointments as against in other countries where you have to go through your family doctor only. So firstly, you have already panicked. Then you have sought an appointment from a cardiologist who is going to see you. And in the bargain, probably a genuine cardiac patient gets pushed in the queue.
Right.
And then you're evaluated. So the doctor checks you up, you do a certain test. And then they say, okay, this doesn't look anything heart related. You are fine. Take this simple tablet and you can go back.
Okay.
So in this process, firstly, you have panicked. You've also gone to a hospital. You have seen a cardiologist who did not need to be involved at all. So there's a financial burden, time, and the emotional, rather mental trauma. As against now, example, you have a headache or you have a heartburn. You come to me. So I will examine you. I will take your history. And I will say, okay, Shilpa, today it does not look like it is heart related from what I have seen. I'll give you these medicines. Let's wait for 24 hours to see, and I will warn you. If you have the following symptoms, come back to me and then we'll see if you need a cardiac care or anything else. I have taken the example of cardiac. So you are relieved. You are happy with the quick consultation. You haven't spent excess amount of money as well. And you know you can come back to this person when you're not well.
Okay.
So you see how simple it becomes.
Right. This probably works when there is no emergency.
Yes.
Suppose there's an emergency and the concerned person approaches the family doctor. How fast can this be sent until a specialist? Because I have two options. One is either I come to a family doctor and then you route me to the right person and then I go there, or I just walk into a multi-speciality hospital and say, this is what it is, I don't know what is happening to me, treat me. I would have reached a specialist straight away. How does that work?
So there's another catch here. The emergency is defined by the person.
Right.
Okay. So sometimes we don't know whether it really is an emergency or it can actually be dealt with in a family doctor's clinic itself.
Correct.
So that is the first thing. But assume, yes, it is a genuine emergency. Either it's a heart attack or it is some surgical problem or something. Even there, most family doctor clinics and setups are equipped to handle that basic thing and triage you, or at least stabilize you, and then send you across to a hospital. Most family doctors, they keep their network that, they can admit in the nearest hospital.
Okay.
So I'm not saying that in a real emergency, if you have walked into a multi-speciality, you will lose out on anything.
No, not
But a family doctor's clinic is equally equipped, is what I would say.
okay.
And sometimes probably you might stabilize and get the treatment there itself.
How different are family doctors from specialists? Can you highlight the differences? This is what I can do, this is what specialists do. You've said how it will help. You've also mentioned about your scope. But in an area where you have all of them readily available and accessible, to highlight specifically what you can do, I think will add on to the awareness that we're trying to create.
Okay. I'll answer that also with an example.
Sure.
So, there is a 30-year-old lady. She's pregnant. She has a little bit of deficiency, iron deficiency. And now she has done some tests and found to be borderline diabetic as well.
Okay.
In a multi-speciality center, she will have to see the gynecologist separately, a physician separately, and then probably an endocrinologist for the diabetes.
Okay.
But your family doctor can treat you as a whole, not your diseases or not your ailments separately. We treat the person. So we will be able to advise you in your state of pregnancy how you can manage your sugars and what else you need to do for your diet, for your exercise. So that way you're not running to 3-4 different people. Here we are giving you integrated care. And I'm not saying that I'm not never going to take specialist referral or specialist care. But I will be at least able to guide you for the best possible option which saves your time and money, both.
Okay. With the rise in the medical field, the technology-wise and medically, have you ever felt that it is a threat to you?
The technology, you mean?
Technology let's put it as technology first.
So, probably in the initial years, I used to feel that if my patient has read and come, they know better than me. What if I don't treat them well? And you have that little insecurity. But I think over the years, I have also learned, I have accepted. So what I do, I do advise my patients that, if you're reading on Google is just a search engine. So you must know the correct website, what you can refer to. And you must also have, a little bit of critical thinking. Somewhere you will be able to understand not to think about the worst. And you can come back to the doctor with that information. We are also the same people who can use Google.
True.
We also read enough. We also have technology at our hands. So I have started advising people, when you read on the internet, read the right material. That makes a huge lot of difference. So I think technology, I have started trying to use it in my practice as against, having a war with it.
Okay. So this is with the perspective of it for as an access in terms of Google, right? What I wanted to ask you was increase or improvement in the medical field in terms of machines, AI, robotics, all of that. Having bigger hospitals, specialists, and access to it. It's not like, earlier maybe we didn't have that access, so we would come to whoever who knows us.
Yeah.
Now I know I have access to this. I know that there are better ways that maybe a multi-speciality hospital or a specialist can treat me. Have you ever felt that to be a threat?
Yes, I think that is also always on our minds. But somewhere we try to reach the midway, and I think have been fortunate that way, that I have made a team with the specialists as well. I have my friends who may be surgeons, who may be orthopedicians, gynecologists, and vice versa. So the teamwork gives both of us confidence that we'll be able to give the best patient care. If I know that my patient definitely needs a robotic surgery, I would advise it upfront. I am not against the advancements, but at the same time, probably I'll be able to guide them to the right person, which suits them in different ways, whether financially. Some people look out for hospitals around their house. So, I think I have really worked hard on that to make my team and my network, where all of us are working in in the same environment, which keeps the patient care uncompromised.
Okay. So, what are some of the challenges you face?
Challenges, yeah, I think every day is a challenge for that matter in different ways. One challenge I would say is from the patients, from the community itself. What we've been discussing, that the whole concept of a family doctor has, kind of blurred and dissolved and not clear as against how it used to be previously. So that is something we're trying to bring back, that seek your family physician first, speak to your family doctor first, and then get referred accordingly.
Okay.
So that is one challenge. The other challenge is, again, trying to bring awareness about this specialty even among the medical fraternity. So in India, the awareness of family medicine is relatively less. There is more access, like you said, to the specialist culture or to the multi-speciality hospitals. So even there, we are trying to create an awareness among our colleagues that, when we work in a team, it is going to benefit the patient in long term, and it is the other advantage is it is going to save their time, where they can actually concentrate on complex surgeries, complex treatments, specialized care, and the simple things can be taken care by us.
Okay.
So that way they are also helping the patient, and we are also helping the patient, and time is saved. Time and money both are saved.
What's the best that we as society can do for this space?
Yeah, that's I think difficult. One is, I think, consciously try to have a family doctor for you whom you can reach out to, so that you also don't have disintegrated care. You get a skin rash somewhere, you go to one doctor, and then because you have diabetes, you're going somewhere else, and then you get a stomach pain for some reason, you go somewhere else. So sometimes all these could be interlinked. So if you've gone to 3 different doctors who don't know your history and your background, that link may be lost.
But ideally, when you go to the first specialist itself, shouldn't that person actually tell you or diagnose you, right? I shouldn't have the need to go to 3 different specialists, right?
So that's the thing, no. That's why you should go to your family medicine specialist. If you have gone to either one organ specialist, see, that's how, no. Somebody who's a software engineer, a mechanical engineer, a civil engineer cannot advise about the other field.
Not the advice, but the diagnosis.
Same thing, yeah. So they may or may not be able to diagnose it because it is not part of your what do I say? It's not part of your field at all. It is completely different. And you have chosen to specialize in that particular branch, right? You've chosen to do software engineering. If I come and tell you that give me a design for this building, you cannot. So, but a family doctor is somebody who is specialized to integrate all of this together.
Okay. Moving on to what you encounter on a day-to-day basis. What are the typical issues that patients come to you with?
Okay, so I get people who may come with fevers, and fevers could be for various reasons. It could be a viral infection, a bacterial infection. Nowadays, we see dengue, we are seeing typhoid, so fevers. There may be people with headaches, which could be migraine, which could be stress induced. Then people with vitamin deficiencies. Then I get a lot of people who actually come for a lot of diet advice and wellness advice. So because I have a special interest in preventive care.
Okay.
So because of that, I do have a lot of my patients who are seeking advice on how to maintain a good lifestyle. So that is one thing. Then I also have interest in spreading awareness about the importance of vaccination. So whether it is adult vaccination, or you need vaccination before you travel, either if as a student or you're traveling abroad for work. So I really take time to explain to people about the need for vaccination. And then I deal with diabetes, blood pressure. These are called lifestyle diseases or non-communicable diseases. So I think it's a huge variety of patients that I see. And not to mention, like I said, some people just want to come and talk to me.
Okay. So, are there areas that you want to highlight that, these are also areas that I can look at, but typically people don't come?
I think as the awareness for your family medicine specialist increases, they are coming. But I think especially these non-communicable diseases is when people try to seek out certain specialists who may not be able to address their problems in whole. So non-communicable diseases is something that the family doctor can treat best. Also because they know their lifestyle, they know their routine, they know their family history, what happened to their parents or grandparents. And as of now, if you see how the office routine is, work from home, or are you traveling to work, so your family doctor takes all that into consideration and is able to advise you.
So when you said non-communicable diseases, could you specify what that is?
So Infections are something that can be communicated from one person to another. Okay, they spread. Non-communicable diseases are those which don't spread person to person. It's because of our habits, lifestyle, or genetics. So they form the basis of maximum diseases in India currently, at least, and even over the world. Diabetes, blood pressure, high cholesterol, obesity, fatty liver disease. So all these come under that gamut.
So it's like your lifestyle diseases.
Completely, your lifestyle diseases, because it is because of our not so good lifestyle.
Right. With the rise in cancers and these lifestyle diseases, do you encounter people who you have diagnosed into these?
Yes, many. So like most of us who practice nowadays, we get a lot of people who have done their complete body checkup and come to us. So I definitely believe in people doing these preventive health checkups for a few reasons. One, these lifestyle diseases especially do not always come with symptoms. So if you're going to wait for a symptom, then check up and then come to your doctor, sometimes that could be late. So I definitely advise that. Second, sometimes you could be pre-diabetic, borderline cholesterol, or a beginning of some, say, cancer lesion. So if you have evaluated yourself early enough, you can actually make lifestyle changes to prevent that disease completely.
Okay.
A third scenario, okay, you want advice from by doing that health checkup because somebody in your family has had a particular thing. You don't want to go down that road at all. So you have done your complete evaluation and you come and meet your doctor. So I really am a believer in these, because with these health checkups I have diagnosed high blood pressure, fluctuating blood pressure, diabetes, and even a few cancers. And I feel happy that I've actually caught it so early that we've been able to treat it and completely cure the person. Say example, if it's a cancer, with diabetes, with the right advice, they have actually brought it under control. Otherwise, because if you're not going to have a symptom, how will you know you have to make some changes in your lifestyle?
Okay. So I have a very it's a very interesting question for me.
For you.
So when you encounter patients who've gotten diagnosed with cancer or something serious while during their health checkups or with you for the first time, as a family doctor who holds the responsibility of the entire family, how have you communicated that to the patient?
Yeah. So, as per our curriculum, we have this topic called breaking bad news. We are supposed to be trained how to break a bad news to a patient. And, obviously, like you described, it's a very formal setting. It's a doctor's clinic.
Right.
It's not like you're sitting in a casual, comfortable place. You've already come with a lot of anxiety.
Correct.
So the whole onus is on the doctor to make you feel absolutely comfortable with whatever that news is. And trust me, no news is easy to break, whether it's even a diabetic, values, or you see, it could be something as simple as thyroid, or it could be something very serious like cancer. So I think consciously we practice a lot of empathy, taking time to explain that diagnosis and giving time to the person to accept it. It's not like a simple cough, cold, or fever that, okay, take this tablet and you'll be fine and you can go back home. That empathy, that bond, and that understanding has to be there in it. So I think what I try to do is also give time. I don't, I probably block that much time for that patient because I know that something important needs to be discussed, which cannot finish soon and, packed up and you go ahead with the next one.
Have you had instances where this has gone really bad?
Gone bad? No, it's not gone out of control, I think. It has been difficult, yes, or it has taken time for the person to accept it, and there might have been long conversations, or sometimes there have been instances wherein they might go back that day, but then they come back for clarifications or to confirm or to, get some answers. So I wouldn't say that it has gone completely wrong, but it has been difficult or challenging for both the patient and me.
Okay. Do you personally feel that you hold more responsibility when you speak about these things to the patient than a general specialist?
You mean that if they have come to me, it's my responsibility?
No, as a doctor, everybody holds a responsibility while talking about any diagnosis. I get that. But as a family doctor, do you feel you hold one level more responsibility because you deal not just with the diagnosis and that person's not just another case for you? It's an entire family that you know, probably have built a bond over the number of years that you've interacted with them. So do you personally feel that it is more, it's more of a responsibility than what it could be for?
Yeah, sometimes yes, I think sometimes yes, because I might know the person and the family and the background and what impact that whole news might have on them. So yes, I think sometimes I do feel that I am a part of that whole diagnosis itself. It's not for me that some person has come, I read out some diagnosis and then you walk out and the day is over. I think many times we do get involved in that whole process itself.
Do you also get emotionally invested?
Sometimes yes, probably when it is very very difficult, or probably when I know that there are certain limitations to the treatment, then probably yes.
And how have you handled yourself?
Good question. So probably from maybe I could say from the COVID times, I have also started reaching out to my friends so that I am not dealing with alone. I seek advice from my friends, I mean my doctor friends or colleagues, who will be able to also give me a perspective by detaching themselves, right? So if I am emotionally invested or I am probably biased, so I always seek advice. It's you can take it like therapy, or I take an opinion from another doctor who will be able to help me out of that situation, because everybody needs some sort of support.
Right.
And I think, yeah, that's a good question, that from COVID times we all doctors also realized that we need each other's support at all times. Probably in the olden times it was not like that. You have your clinic, you're seeing your set of patients, and you're busy with that and life goes on. But now we all do reach out to each other, we meet each other often, we try to share these difficult instances so that we also know how to deal with it. And sometimes we may need only that other friend to listen to us. So we are as human as everyone else is.
Sure. So with this one thing that you seek advice from your peers as well, right? How do you manage to maintain your relationships outside of what you do as a doctor?
With my friends, you mean?
With your doctor friends. See, it's not just going to work with one phone call and then you ask them. You would have invested your time in building that relationship as well and keeping it going. With due respect to every other profession and people and all the time that they have, I'm sure you have a very busy schedule in a day, right?
Yeah,
how do you handle all of that?
Yeah, I think be it any profession, we have to consciously make that effort. I think it comes down to that. It may be less frequent compared to other professions, like you said, we don't have weekends, or we cannot have that many holidays or that much time to spend. But even the little that we make time, I think it goes a long way. So frequency may be lesser, but I think the effort and the emotion is same whether it's any profession.
Okay.
Yeah.
So when you deal with patients who come to you, and any diagnosis for that matter, have you had people who don't take your advice?
Oh yeah, I think that also does happen. I think that's a part of the profession.
Okay.
It's the best that I can suggest. It's the best advice that I can give. Probably also make them aware of the complications. Then it's up to them.
So have you encountered patients who don't listen to you, and then if they come back to you with a worse condition, What do you do and how do you handle those people?
Yeah. So, of course, I give them the best treatment. And, sometimes they themselves realize that they should have listened to me in the first place.
Yeah.
Otherwise, they wouldn't have landed here. And sometimes people, they say that, okay, now at least give us the best treatment, because probably they've had a reaction, or they're really not keeping well with, what they did before. So it is a little difficult at that time to keep your emotions in control, and to say, look, I told you. That is the kind of thing that goes on in our mind. I told you. But we have to just overcome that. I do the best treatment anyway. And I think that incident itself is a good lesson for both of us. For the doctor also, I learn, okay, to handle myself, and then the patient knows that it's best to follow at least the basic instructions that are given.
Right. But how do you control that I told you?
Very difficult, very difficult. I think it depends on the intensity of the reaction.
True, because I think anger comes along with it sometimes, depending on the intensity of what happens with the patient, right?
Because sometimes, I don't know, and whether the anger is, for ourselves,
True.
did we not advise enough? That's the question, we start asking ourselves. Did we not convince them enough? Because all said and done, you will still feel, probably the doctor did not tell me, so I did it.
Self-doubts.
Yeah, self-doubt. So that definitely comes.
Yes.
And I think if I have known the patient long enough, I am quite upfront with them that, you should not have done this, and now just listen to me.
Right.
So I think that's another liberty that your family doctor can take with you. If you know them well enough, you will also not mind it. You will take it in the stride, and the doctor also will take that liberty to actually put the foot down. When I know, if it's you have to do this, because I have seen what could happen if it's not followed. So that is a little thing that we learn over time, I think. Nothing else.
Okay. Have you had instances where there are very serious criminal involvement in what you see, and probably you're not able to communicate to them because there is no evidence, or maybe not a direct diagnosis that you have, but you suspect, like for instance an abuse or anything on those lines. Have you encountered anything like that, or have you had peers who have encountered something like that, and how does a family doctor handle these things?
So during my training, yes, I did encounter, because we would be on night duties or even otherwise. So at that time, we have encountered wherein it's a difficult situation. Something is wrong and you cannot really say something about it. In my practice, I would say, actually, now that you asked me, I remember, I think I've had 2 such instances. And, we have to be legally right. So I haven't really been able to put it down in the official way. But in those instances, what I tried was to give my support to the patient and offer support groups and psychologist help as per that situation, so that they know they can reach out to me in some way. I cannot upfront tell that, look, either you're wrong or your family is wrong and you need a legal support. That I have not done, of course. But I have tried to make them feel that, look, I'm there for you. And if you need any kind of psychological support, or if you feel even medical support in that way, I have, tried to assure them.
Okay. How about, I'm just trying to pick instances so that people understand areas that they can come to you for, right? Have you had instances where you see it is a serious domestic violence, but has started on a very low scale? You know it's wrong, but you cannot outright tell the person that, see, this is a red flag, this is not right, or take your step, stop this. You can't make those statements because medically you have certain responsibilities, but you know it's going in that direction, and you know what's going to happen next as well. On those lines, have people reached out to you in those angles, or if they reach out to you in the near future, what is it that you can do as a family doctor?
So, I think, again, legally I cannot do much. Yeah. I can advise them, and like you said, if I think it's the initial stage. So uh, in India, probably it might be difficult. In the West, it's easier, where you can talk to the patient alone without the family involvement. But here, that is almost difficult. There will be
Why do you say it's difficult?
the family members will always be with the.
They're not okay.
Yeah, they will be with the patient, right? So you can't really have a one-on-one conversation. But we try to do it in such a way to let them know that the doctor support is there at whatever point you need. If you take a step ahead,
Okay.
we cannot take that step ahead, we cannot document that, but probably just let them know that medically or as a support, we are there for you.
Moving on, what are the preventive measures that people can take to have a healthy lifestyle?
Lot of things. The cliche things like balanced diet,
Okay.
exercise, but I always try to customize this when I do my consultations. So you should know what is a balanced diet for you,
Okay.
what is the right kind of exercise for you. So a good mix of cardio as well as some sort of resistance exercise is a must for preventive health, because when our muscles are healthy, our metabolism is in place, and we can prevent most of the lifestyle diseases. Eating a good balanced diet. So it's not about, completely cutting off any particular food item, but eating it in the right proportion at the right time is very important. So I usually tell this very commonly to my patients. When you sit to eat, you see what you're eating, how much are you eating, and what time are you eating. You will get your answers in these three questions if it is right or wrong. You realize you're eating at 10 p.m., 11 p.m., you know you're eating very late. You see your plate and you realize that the quantity is more, so you'll know somewhere you have to cut down. And what you're eating, if it's only fried, or if it is predominant carb, or if it is high in sugar, you will realize. So over time, these three questions will help you understand how to balance your diet, because the key is balanced diet.
Okay.
And then certain things like taking your vaccinations. I mentioned about the importance of adult vaccinations. Even more important now, see, we all have crossed the and survived the COVID epidemic.
True.
And definitely the vaccination has played an important role, because it has actually prevented a lot of deaths and a lot of hospitalizations also. Like we know historically, when the Spanish flu hit, half the population just vanished. That way, there are a lot of vaccine preventable diseases like flu, pneumonia, hepatitis, typhoid. So when I say vaccine preventable, I don't mean that you will never get a flu or you can never get a typhoid. But I can assure you that your infection will be mild. You can be treated at home without the need of a hospitalization.
Okay.
So that itself sounds very reassuring. Like, that, okay, doctor, I'm not well, just give me some medicines, I will rest it out, and I should be, back to my work or back to my life after that days. You don't want to get hospitalized, right?
Right.
So that is what the vaccine will do. It will prevent your chances of hospitalization by reducing the severity of that infection. Whether it's chickenpox, pneumonia, flu, hepatitis, typhoid. So adult vaccination is really important. And we've been reading that I think by the year 2036, almost 25% of the population is going to be in the 60 plus age group.
Okay.
So we all are going to grow older and live longer as well.
Okay.
So we'll be living with diseases.
Right.
So preventing these infections holds the key.
Okay.
And active lifestyle.
Sorry. What about the general notion that vaccines have side effects, right? So, do all vaccines usually have side effects, and are they safe to take?
So side effects again is a very, very subjective term. Yes, when we take certain vaccinations, you are going to get a side effect of a body pain or a fever like feeling or feeling dull, which goes away. after say 24 to 48 hours. Some of them may get pain at the site of injection, which again comes with the effect because it is mimicking that infection.
Okay.
But to say that your vaccine has not helped you or it is unsafe, well, it will not be available, and the the evidence that is there that it has prevented so many deaths or infections, it wouldn't survive that whole era or the whole time period.
What are the typical vaccines that you recommend people to consider?
Flu,
Okay.
that should be taken every year, the pneumonia vaccination, and actually off late I have started advising for the typhoid vaccine because a lot of waterborne infections have started. So with the rains in Bangalore, or it could be in any part of the country, but these are infections which we can easily prevent. So typhoid is one, the chickenpox vaccine, and in elderly, definitely we do recommend the vaccine against shingles, which is the herpes zoster. So only people who have actually seen their relatives going through that or have actually experienced it know the severity of pain that it brings with it.
True.
So I usually categorize them as mandatory vaccines and recommended vaccines, and then individualize it depending on the age, the comorbidities. So people who have heart disease, kidney problems, they may be cancer survivors. So they do need something more than a relatively healthy individual.
Okay. So when are vaccines typically part of the health check?
So not everywhere.
Okay.
But in my practice, I have made it a part of my daily conversation with all patients that I meet, and try to sensitize them, create awareness for the importance of vaccination, so that then they will also read and come back. They will discuss at home, in their offices. So if one person has taken it, they may be able to inspire their relatives or their neighbors or their colleagues. So I think creating awareness is equally important, and that is the first step.
With the rise in the financial side of the medical field, where it's all very expensive right now, a lot of people, probably that is one of the reasons why people try and figure out what they should do if there is an issue. So two scenarios here. One is, if it's something mild like a fever or a cold, cough or something like that, people maybe they'll come once to a family doctor, figure out that this is what you're doing or this is what you recommend repeatedly. So they start taking it in themselves. On the other hand, they would have heard people say that if you have this, take this, and then go ahead. What is your take on people who treat themselves with or without your advice on a repeated basis? They could be your patients who do it. They know that this is what you'll recommend, so they do it.
Yes,
they take it.
yes.
That is one side of it. The other is, even without checking with a family doctor, because they know it's a general thing that you check and it's nothing serious, because you will recommend if it is like that, so I will take this. What is your take on this?
So self-medication, self-treatment is not recommended, definitely. But if I want to add on, at one point you may feel, okay, it's not something major that I need to see a doctor. I would say, please avoid taking antibiotics. You can take your regular paracetamol or your tablets, say decongestants or something. But at any point, any tablet can cause, or any medicine can cause a side effect. You could have a rash, you could have some allergy, which again has to be handled by a doctor. And sometimes you may be taking the same tablet over years, and suddenly one fine day it has still not suited you.
Correct.
So I think to prevent these complications, wherein again you're going through so much of emotional trauma, mental trauma, you may be trying to save money by initially taking medicines off the counter, and you'll end up spending much more because it has led to complications. So I would still advise, even if it is something simple, it's better to get the right guidance from your doctor, because he or she knows best. We may be able to recognize something hidden as well. And we may be able to avoid those complications that may occur. But a strict no is about antibiotics. I would like to request even the chemists and pharmacists to please not give out antibiotics when it is asked by patients, and definitely not give incomplete doses. India is actually the capital of microbiological resistance. The maximum resistance that the bacteria and viruses have developed, and the newer antibiotics also don't act on them. So India is facing that AMR challenge in a huge way. So simple medicines do not work against the bacteria at all, because there is irrational use, incomplete dosage, and probably not the right tablet at all. You take 2-3 tablets, you feel better. You will feel better because you would have felt better even without that antibiotic. So then the bacteria has, adapted itself to not get affected by that medicine.
Could you highlight on what really happens if you take antibiotics, overdose of antibiotics, and repeated use of antibiotics?
So overdose, mainly it will affect your gut. So many people in the long term, if they have, they have the habit of recurrently taking antibiotics for any infection, the first thing that takes a toll is their gut. Their metabolism gets affected, digestion. They may have issues with either constipation or anything related to digestion. It's not a normal routine. The other thing that people commonly get is a lot of skin issues. So overuse or even underuse, rather you have not taken it in the right way, can have all these impacts. And very rarely people may have even fertility issues
with antibiotics.
Yeah, with overuse or not in the right way. That will not be directly, but somewhere it is going to be playing with your hormones. So that way there could be so many side effects when not taken in the right way, which you will not be able to recognize initially. So always take antibiotics only with prescription.
Okay. What about when you're prescribed antibiotics? Is it okay to take?
Yeah, if you're prescribed for an infection, it has to be taken.
Has these effects.
No, it does not have these side effects. You said when there is overuse or irrational use, there might be some problems happening in the future. But you have an infection now, you take antibiotics for 5 days and you're up and about.
Is that okay?
So that is correct. Yeah, when you're prescribed, you have to finish the course.
Okay, what happens otherwise?
So the bacteria gets resistant, and then the same drug cannot be used for someone who genuinely needs it. Say a cancer patient having a severe infection, an elderly person, then those antibiotics don't work for them at all.
Okay. So it's more of the lack of knowledge, or is that what you would say? That people just take it over the counter?
Access.
Convenience.
Easily accessible, no? You can actually buy antibiotics over the counter in India. That is the one major problem. Okay. See, if it is not available, you will not take it. You may take, it's okay to take a paracetamol, or you have taken some other decongestant, one cough syrup. But antibiotic is completely different. I mean, the way it has been discovered and then it has been manufactured, the biochemistry of it. So, you can't just take it in an incomplete way.
How much is too much of an internet knowledge for people?
How much is too much? That is difficult because you cannot measure that.
In the medical sense.
Yeah.
I'm just asking.
That's why when I said earlier that how I deal with it is, you have a problem, I will tell you what articles to read online. So that is the best that I can do. Of course, I cannot restrict you from not reading something. I have had people who see Instagram reels and come and tell me I want to do this particular test or I want to try out this new medicine. I saw it on Insta. So, there is no end to how much. But I would rather be aware that this trend is picking up, and should I advise it or should I advise against it? It's equally important that I am also in sync with what my patients are seeing and reading.
But do you recommend that you don't really look at the internet and figure out what your issue is?
No, you don't figure it out. You come and ask me. Okay, I read this or I saw this. Is it correct? I'll say, see, there may be things which are right. So I will tell you, yes, this is correct, so do this, this, this. Or I'll tell you, no, this is wrong, so avoid this. I think instead of blindly following it, rather confirm it with your doctor.
So, doctor, to wrap up our wonderful conversation, what would you like to advise the younger generation who would want to take up family medicine as their career?
So I do get these queries regularly as a part of my family medicine association that we are, and we try to meet these medical students to create an awareness that yes, it is a very, very fulfilling branch, and it is something really essential that we need, especially in India. Because what we've been discussing from now, that people seek specialist care for minor ailments which can easily be treated by your family doctor, and it will save a lot of time and energy. So it's a very comprehensive and integrated branch. So highly advisable that if you're able to take up this branch and continue, then sky's the limit. There is no limit to what you can do. It's not like some new thing is going to threaten you. You even asked me this, if there's a new technology. I think family doctors are most adaptive that way, because an example that I gave you, the kind of patients we see through the day, there is no set pattern. Every person walking in has something different, so we quickly adapt to that situation and advise accordingly. So any newer advancements, newer technologies, everything will come under our advice as needed. So it is the best branch or the best field that one can think of.
Yeah. Thank you for that wonderful conversation. Thank you for taking your time in between your very busy schedule, I'm sure. So thank you once again.
Thank you so much for having me here.